Hi everyone, this is Katie Boone, Public Health Specialist for Jackson County Public Health. Just recording this Zoom for you today to help get prepared for the upcoming school year and to kind of give you a little bit of advice and guidance for what's to come this year. So welcome back. Wanted to start with a little bit of humor to help lighten the mood, just to let you know that we understand that kids will be kids and this won't be perfect, but we'll give you the best tools and strategies you can use to help prepare you and make you feel as ready for the school year as you possibly can be. So how we got here, we've had a partnership with the Jackson County School Districts and Jackson County Public Health. We have done a lot of collaboration, had a lot of meetings, done a lot of planning, essentially since last March when schools closed. But we've done, again, a lot of meetings, a lot of planning, and a lot of questions by each other to help be prepared for this school year. So we'll also introduce our public health staff during this recording for you, so you can have some familiar faces, hopefully. Ellen Moldenhauer is our health officer. Christy Hansen, one of our public health nurses. Tammy Handley, another one of our public health nurses. And Kathy Rumsey, another public health nurse here. And then myself, Katie Boone, our public health specialist. So currently what we know about COVID-19, so it's that really new or novel virus. As it is so new, there's guidance that's continuing to change, there's ongoing research, there's vaccine development. With all of that, as there is ongoing research and development with that, our guidance tends to change. So just be flexible, be prepared for some changing guidance as school goes on, but we'll get whatever we can get out to you as soon as we get it. We also know that there are symptoms that are associated with COVID-19, and those are fever, cough, shortness of breath, sore throat, nausea, abdominal pain, loss of taste, chills, headache, muscle aches, runny nose or congestion, vomiting, diarrhea, and loss of smell. The plan for the school year is to be a face-to-face virtual hybrid education. So face-to-face for those who are comfortable and virtual for those who are not. And then each school district will have their own COVID-19 response team. These will be the individuals that will be your points of contact for COVID-19 related questions and concerns. And they will have direct contact with Jackson County Public Health. So that team will be the one to organize the maybe commonly asked questions or scenarios and send them our way. We would just prefer that, as it would keep our communication streamlined and prevent duplicate questions and duplicate work when at all possible. Also part of our plan for this school year is the risk mitigation strategies. So incorporating social distancing, having smaller groups or class sizes, really pushing the hand hygiene, lots of extra hand washing or hand sanitizer. And then per Governor Evers' emergency order, masks are required until September 28th this year. And then also having sick student and sick staff strategies. So we developed what's called an exclusion algorithm to help facilitate this. So we'll start at the top here and just kind of briefly explain. So the red, the symptoms in red would be something that you would want just to go straight down this side of the list. Symptoms in green can either go down this side of the list or this side of the list, depending on this yellow box here. So do they have another explanation for these symptoms? Is, maybe allergies or something else, but that would be just for the symptoms in this green box. If they have any of these again, you'll want to go straight down this way. So we'll start with the symptoms here in red. If they have any of those, you'll want to go straight down the line here, this first stop sign, and then send the student or staff member home. If they are getting picked up, you want to isolate them until they are able to be picked up. And then you'll want to advise either whichever guardian comes to pick them up or caregiver that they should call their doctor, have a referral for a COVID-19 test, or maybe even just get further advice. Obviously, if it's your staff, you can just advise them yourself. And then if you continue down to go this side, if a COVID-19 test was completed and they have a positive result, the health department will follow up with each designated school district contact, or I should say a school district designated contact. And then they would have to be out for a minimum of 10 days and then 24 hours fever-free without the use of medication. So it has to be a minimum of 10 days. If they have 24 hours fever-free within those 10 days, then they can return to school for work after those 10 days. If they still have a fever at 10 days, they have to break that fever and be fever-free for 24 hours without using any fever-reducing medication. If they have a negative test result, the student or staff member must be fever-free for 24 hours without the use of medication before returning to school. I think that's pretty common practice. You'll want to have them feeling better and not having that fever at school before they return. And then if they do not have a COVID-19 test, the student or staff can return with a doctor's consent or after a minimum of 10 days and 24 hours fever-free without medication. So if they don't get that doctor's consent and they were, experiencing COVID-19-like symptoms that got you down this far, to be safer this year, kind of take a little more precaution. We would not want them to return until that 10-day time frame is up, and then again that 24 hours fever-free without medication. So if we go to the top of this chart again, and it's in the green category, then if they have any one of these symptoms, you'll want to go down this side. So if they have no symptoms at all, let's say, we go down this side, and then is that student or staff a close contact to a positive case? If they are not, they have no exclusion from class or work. If they were a close contact to a positive case, then those close contacts are identified by the health department case tracing team, and then they will be required for 14 days to be quarantined, and that would be from their last exposure to a positive case. They should also monitor their symptoms daily. And then if we do, so let's say they do have a symptom here in this green box, but it does have another explanation. So maybe they have a little bit of sore throat, but that's from allergies. Then you would go again down this side here. So, you talk to them, you have that conversation and discover, yes, it's from allergies. Then were they a contact? Again, go down this way. If they were not, no exclusion. If they were, then they would have been identified by the health department. If we go down, back up to this green box, and they do not have any other explanation for one of these symptoms, then you'll want to go refer right back down to this side of the chart. But I know a lot of information to take in and soak in. You can get copies of these from, I believe, your superintendents. This has been shared with them. Otherwise, if you don't have a copy, request one and we can certainly get one to you. But again, I know it's a lot of information to soak in, so if there are questions, please let us know. And then we do get some common questions here. So we'll go through some of those quickly, and then if you do continue to have more common questions, again, refer them to that COVID-19 team, and then we can kind of go through and do another common question list again. So one of our common questions is, can school administrators ask students and staff members to report their exposure status? If a student or staff member needs to be absent from school because they are being quarantined, they will be asked to report the reason for the absence to the school to assist in disease monitoring efforts. Jackson County Public Health may also contact schools to inform them of cases. Can schools inform other students, parents, or staff if an individual who was in school tests positive for COVID-19? School districts have the right to inform other students, their parents, and staff if an individual who was in school tests positive for COVID-19 so long as no personally identifiable information will be shared, including the individual's name, grade, if they were a student or staff member. Additionally, other individuals must be absent for other reasons to ensure that a reasonable member of the school community could not easily identify those who may be absent due to COVID-19. Another common question that we get is, should schools contact local and tribal health departments if they send a student or staff member home with COVID-19-like symptoms? Is it legal for schools to disclose this information to health departments? Yes, schools should contact local and tribal health departments of suspected cases, and they should keep a list of symptomatic students and their close contacts that can be shared with public health to assist contact tracing efforts if needed. What is the definition of a close contact in the school setting? Close contacts are generally considered those who have been within 6 feet of someone for 15 minutes or more. Other potential factors or exposures may need to be taken into consideration, such as whether someone was sneezed on while passing in the hallway or in class. And to add to that 15 minutes is cumulative. So if they only see the close contact, or the positive case, for 5 minutes but 3 separate times, that would still count. So again, that 15 minutes for this close contact definition is cumulative. Do staff and students who are exposed to someone with COVID-19 need to quarantine if they were wearing a cloth face covering? Yes. Outside of a healthcare setting, Department of Health Services, or DHS, is recommending quarantine for individuals who are deemed close contacts, even if they and/or the positive case were wearing a mask or face covering. The rationale behind this is that outside of a healthcare setting, there are a wide variety of masks and face coverings being used with unknown effectiveness. The use of masks or face coverings likely reduces the risk of transmission, but we still do not know to what degree. For these reasons, we encourage the use of masks, but don't have sufficient evidence at this time to change quarantine recommendations. Should schools require a negative test result for student or staff before returning to school after they have been sick? No, it is not recommended to require a negative test before returning to school or work, as testing supplies and laboratory capacity are limited, and there have been reports that an individual can continue to test positive long after they are considered to be contagious. Students and staff can return to school after 24 hours have passed without a fever and without the use of fever-reducing medications, improvement in respiratory symptoms, and at least 10 days have passed since their symptoms first appeared. Students and staff who did not experience symptoms but tested positive can return to school after at least 10 days have passed since the date of their diagnostic test. What if a student has a parent or sibling identified as a close contact of a positive case? Does that mean that student should not come to my class? That student is not the identified close contact. Therefore, they may attend school. It does not become a contact of a contact. If the close contact develops symptoms or a positive test, then the student should stay home and quarantine. If I am deemed a close contact by the health department, should I get a test? No. Testing is only recommended for those who are symptomatic. An increase of tests for non-symptomatic individuals can cause delays in testing result timeline for those that are positive. These tests are only point in time. If you are a close contact, it is possible to develop symptoms between 2 and 14 days. So here's where we would refer you to find current, reliable, and up-to-date information. So a great place to go is the CDC. Also, for more local Wisconsin-related information, you can go to the Wisconsin Department of Health Services. And then even more local for Jackson County, you can check out our public health Facebook page or our public health webpage. Most of the same information will be on the Facebook page as is on the web page. We just have 2 platforms in case people do not have Facebook. But on our public health Facebook page, we'll put our daily updates to our COVID-19 numbers, as well as any public notifications that need to be put out. So just wanted to end with a little bit more humor. Time to take a deep breath. I know that's a lot to throw at you, soak it in. Write your questions down, refer them to your COVID-19 team so they can get in contact with us. Don't be afraid to ask any questions. I know it's a lot to take in. It's a lot of information out there. But good luck, you can do this. And again, refer those questions on if you have them.